Health Minister Dr. Zweli Mkhize has been placed on special leave in the wake of a storm of controversy around that Digital Vibes contract. Meanwhile, teachers who were supposed to receive their Johnson & Johnson COVID-19 vaccine jabs today will have to keep waiting. This is pending a probe by the U.S. Food and Drug Administration, which is expected to clear the dispatch of 31 million doses bought or rather ordered by South Africa. In phase 2 of the vaccine rollout, just over 1.4 million people have received at least one jab of the Pfizer vaccine. Dr. Nicholas Crisp is the man in charge of the department's Electronic Vaccination Date System. He joins us now to get us a sense of how the scaling up of vaccinations is likely to take place. Dr. Crisp, thanks for your time. Great to have you on the program. It's incredibly difficult to view anything that happens in the health department outside of the context of what's happening to the health minister. So perhaps let's start there. In what way, if any at all, is waking up to an acting health minister going to affect the work that you do?
Morning, Ayanda, and morning to your listeners and viewers. We obviously will miss our minister. We have a very close relationship with the minister, working in the way we do in the health department. But we have a very strong team of people who are working on the vaccination program. We work very closely with our colleagues in the provinces. We have a good working relationship with the private sector that is sustained for a long time now. So we will just continue to do what we are doing and knuckle down and make sure that we roll out the vaccine program.
You say you're going to miss the minister. That suggests to me you have worked with him in relative closeness. Did you get a heads up that you might have to prepare for another person who might be filling his post?
Well, he's a very Dr. Mkhize was a very hands-on minister, so everyone in the department has had exposure and worked with him, so that would be nothing strange. But, we see what we see in the media, and we've all been working hard together and making sure we have plans, so nothing's changed for us. We will continue with the plans we have.
Okay, I presume the answer to that is no. And I'll tell you why I ask. I mean, typically you'd need some kind of handover to take place, and we'll speak about the EVDS in just a moment. But is that something that you would need in order to continue, at least on the trajectory that you were, with the health minister?
There's always political issues that need to be handled in any portfolio, so the Director General will do the handover, but the rest of us are working very closely with our DG. And we have a team of people, as I say, that's been working on all aspects of the vaccine for a long time now. So it doesn't affect us in our team.
Fair enough. Let's speak then about what you do more closely. Last time I checked, about 3 million odd people had registered on the EVDS. What's that number looking like now, and is it moving fast enough?
Yeah, it's very close to 3.5 million now. And that includes from the time of the 400 and something thousand people who were vaccinated in the Sisonke trial. And the bulk of the registrations are now obviously over the age of 60. In fact, I saw over the weekend only about 100 healthcare workers registered, and the rest were all over the age of 60. And what's interesting is that we are getting our best registration figures from the rural provinces and from people that we would have suspected have problems using gadgets and following the English language. So Limpopo province has registered by far the greatest proportion of their 60-year-olds, and in fact it's the urban areas where we are having the lowest registrations. But it is moving along, and we're getting about 50,000 new over 60 registrations a day.
It's fascinating, the trends you're seeing already. I wonder how the decision by provinces, including Gauteng and the Western Cape, to allow people to actually rock up at vaccination sites and receive that jab is affecting your ability to track where vaccines are. Has it thrown a spanner in the works at all for the tracking function of the EVDS?
So no, it doesn't affect the tracking at all, because we record a dose when a dose is administered. And as long as it's attached to a person who has an ID number and a way in which we can contact them with either a cell phone or an address, it doesn't affect the tracking at all. What it does affect is the ability of the site where the vaccination is given to plan proactively and to match their deliveries to the number of people they're going to vaccinate. And that will become a challenge as more and more people respond to the scheduled appointments, and there are less and less free gaps where people have not been able to respond. So it's not the way we would encourage things to happen. We also don't want large numbers of people coming to vaccination sites and hanging around because those in themselves become spreader events. So we would really encourage everybody to use the system properly and to wait their turn. They will be called, there will be SMSs, and they will get vaccinations.
I want to just make sure I'm understanding you correctly. So what these at least 2 provinces did is not from advice received from your office. This idea of allowing people to essentially just arrive at a vaccination site without being given a date, essentially, to be there.
Yeah, Ayanda, every province is different, and even within the provinces, the circumstances are different. So the National Department doesn't lay down the law. We have plans, we work together, we talk to our provincial counterparts, we have daily meetings with the senior officials in the departments. So it's not a question of them ignoring or not following. They have their own challenges on the ground, and as I say, from even one suburb to another, the way they have to manage their program will differ, and it will differ over time. Now, in the beginning of the program, when there was less rhythm, if you like, to the way in which the appointments are made, and when SMSs were still only going out 1 day ahead, and now they're going out 3 days ahead, it was more difficult for the public to respond proactively and to get themselves to vaccination sites. There were also very few vaccination sites in the first week, more in the second week, and now well over, very close to 600, in fact, yesterday, plus all the outreach sites. So it now means that there are shorter queues, more distribution points, and the way in which the EVDS is able to distribute people to those sites has a better rhythm to it. So I'm sure the circumstances are going to change even where those walk-ins are being allowed at the moment.
As the circumstances change, which aspects of the system are you hoping will improve?
So I think people think the system is just a booking system or just a reservation system. It's a massive, massive system. And what the public sees is the interface with their own SMSs to call them for bookings or to inform them they are registered. That is just a part of the system. The system also protects the public because we keep records of every single vaccination, the batch that the vaccine came from, the dose, who vaccinated you, when you were vaccinated, where you were vaccinated. And those records, first of all, help us to plan. Where do we open the next vaccination sites where we see the queues are very long? Where do we respond by pushing more vaccine to a particular site because we can see that they have capacity because the vaccinators are scheduled on the system? Where is a site battling with the actual administration of the vaccination program because the EVDS is decentralized to that level? And then all the national central analytics that happens for us to plan together, distribute vaccines, make sure that we don't have 2 or 3 vaccination sites right on top of one another, and then ultimately to report to the Parliament, to the Auditor General, and to the public in general about what we did with their taxpayer money. So it is a massive system with huge capabilities. It's very flexible, and we like it when people bring to our attention when there are sort of aberrant appointments given or missing SMSs, because then we can trace those to establish why there may have been something electronically gone wrong in either the scheduling or the appointments. So we don't mind if people tell us about that, but generally, if we're seeing even 1% of challenges in the system, that would be a lot. It's much smoother than that.
Right. Right. What you've just said will be of great interest to many South Africans, especially aspects around how money is being spent. Is there any room for that information or that data to be accessible to the public if it's not already?
Yes, so absolutely, and even more data and on an ongoing basis will be made available to the public. For now, what we've been doing is tidying up the way in which we report and the labeling on, there's a lot of technical labeling in the back end of the system that we use, and it's not user-friendly and it's not easy to interpret. So the team has been working, and they had a long meeting yesterday to finalize how we present that data in the public space. In the meantime, we now have the stills being presented, and there was a press release overnight as well explaining to people where to go for information about sites, data, registrations, vaccinations, and so forth. From later this week, and I'm not sure of the exact date we'll be able to go live, but it will be this week, there will be an interactive dashboard that the public are able to interact with, and they'll be able to move and search into their own parts of the country to see what's going on.
How do you envision that dashboard being able to work? I mean, do you see a situation where there's real-time updates as perhaps the day progresses, or, you know, will there be more meaning-making opportunity at the end of a time period? I'm only asking this because at the moment, we're seeing, obviously, the Health Department release their reports almost the day after, if you like, whereas we're not able to see how many people have been vaccinated, for argument's sake, between midday and midnight.
Yeah. So, the system, there are two parts to the system. The one is the live system where we can see virtually minute by minute what is going on, and those are the operators who are answering the questions in our digital team. But the live dashboard is being updated less frequently than that, but it's certainly not only once a day. We have to audit the figures that we put into the public space, and there are paper records being back captured, because there were, especially in the beginning, there were sites that were capturing quite a lot of data on paper, and there are now still some paper records being captured, which we see being reflected in the next day's figures. So what you will see there is not live, as in every minute live, but it's certainly every few hours that it is being updated. It will be updated on that public dashboard.
Very interesting. Very quickly, Dr. Crisp, there are a couple of, call it, challenges that we're also facing in the country. One is we're waiting for the FDA to finally say something about the Johnson & Johnson vaccines. That will give us a much-needed boost, and I imagine will create all kinds of traffic on the EVDS as well. In the backdrop, we're also dealing with these rolling power cuts in the country, which I imagine will have some kind of bearing for people's abilities, even at vaccination sites, to use the system. How much of a headache are these two things for you at the moment?
And using the system is not a problem. I mean, it's a cell phone-based system, and iPads and so forth. So as long as the IT is, your actual handset is charged, that's not a problem. And when the power's back on, the data gets pushed back into the system. So for the EVDS system, it's not so much of a problem. It's more of a concern for refrigeration in the cold chain. And there too, sites are not allowed to operate unless they have guaranteed their cold chains and a whole range of other safety measures. So the backup systems that we run in a big rollout like this are significant. And up to now, we haven't really had any concerns or problems. It does frustrate people when they have power off because they can't connect. If their towers are down and so on, they can't connect and talk to us and interact on an ongoing basis. But it's not a major catastrophe for the rollout program.
Fair enough. Thanks very much indeed for your time. Really interesting tidbits, I imagine, for many people to take from our discussion. Thanks once again. Dr. Nicholas Crisp is the man in charge of the Health Department's Electronic Vaccination Data System. Also happens to be the Deputy Director General of the same department. Once again, Dr. Crisp, thanks indeed for your time.